Hi, my name is Waris Hussain. In this video, we are going to know the cardiac cycle. One heartbeat is equal to one complete cardiac cycle. The time period of the cardiac cycle is the 0.8 second. The heart beats average 72 times in a minute. So how the sequence of events will occur in 0.8 second of the cardiac cycle, we will try to understand in this video. So there are the three major events are there. One is the diastole, atrial systole and ventricular systole. So you are seeing here the three diagrams. According to these three diagrams, we will try to understand the three major events. So the first one is the joint diastole. In the joint diastole, the both atria and the both ventricles will be in the relaxed position. The cardiac muscles will be in the relaxed position. The time period of the diastole is the 0.4 second. So what would happen in the 0.4 second? In the 0.4 second, from our body, the deoxygenated blood will be collected through the superior vena cava and inferior vena cava into the right atria. At the same time, the oxygenated blood will also be collected through the pulmonary vein from the lungs into the left atria. So at the same time, the both atria is collecting the blood. So you are seeing here, this is the tricuspid valve, bicuspid valve, that is the atrioventricular valve. The both atrioventricular valves will remain open in the diastolic period. So if the blood will enter into the atria, at the same time the blood is entering into the ventricles. So in the diastolic period, the blood will enter up to the 70 to 80% in the ventricles. So there is no any force, no contractions. So that's why it is also called as passive ventricular filling. So ventricles will be filled up to the 70 to 80%. So this is the diastolic period. Now next is the atrial systole. In the atrial systole, we know that this is the time for the contraction of the atria. So already we know that in the diastolic period 70 to 80% of the ventricles have been filled. So now the rest of the 20 to 30% blood is present in the atria. So when the sinoatrial node will generate the electrical impulses, the both atria will contract. So the 20 to 30% blood will also be ejected into the ventricles. So the ventricles will be completely filled. So after the immediate contraction of the atria, the both tricuspid valve and the bicuspid valve will be closed. When it will be closed, it will generate the first heart sound, that is the lub sound. And the time period of the atrial systole is the 0.1 second. So in the atrial systole, the ventricles will be completely filled. Now the third event is the ventricular systole. In the ventricular systole, the ventricles are completely filled, and before contraction of the ventricles, the pressure will remain up to 0 to 80 millimeter of mercury. And in the right atria, from 0 to 10 millimeter of mercury. When the atrioventricular node will generate the electrical impulses, it will generate the electrical impulses through the bundle of His bundle branches and the Purkinje fiber. The both ventricles will start to contract. The pressure will increase up to 120 millimeter of mercury in the left ventricles, and in the right, up to it will be filled. It will increase up to the 15 millimeter of mercury. At that time, at the high pressure of 120 millimeter of mercury, the aortic valve will open and the blood will be ejected into the aorta. And here is the 15 millimeter of mercury. The pulmonic valve will open and the blood will be ejected into the pulmonary artery. So when the blood will be ejected, after the contraction of the ventricles, the whole blood will be ejected into the pulmonary artery and the aorta. After the ejections, immediately the both semilunar valve will be closed. When it will be closed, it will generate the second heart sound, that is the dub sound. So you are seeing here the high pressure of the left ventricle is 120 millimeter of mercury and the low pressure is the 80 millimeter of mercury. Often we are reading the pressure of the left ventricle. Now come to the ECG pattern. According to the ECG pattern, we will try to understand the physical contraction of the heart. So first you are seeing here this line, this is the diastolic period. This is the P wave, the both atria will contract. The QRS wave, the both ventricle will contract. Again repolarization, the ventricles will come into its normal position. So this is the cardiac cycle. Complete cardiac cycle. Thank you.